Happy Wednesday, everybody. We're live for Lunch with the Doc. Today, we're going to teach you what you can do to prevent and treat achy joints. It's going to be jam-packed with info. It's going to be great. So, Dr. G, can you tell us about arthritis? What is it, and what can we do to prevent it?
Well, arthritis, what that means in Latin is arth means joint, itis means inflammation. So arthritis means joint inflammation. Now, joint inflammation can come from a lot of different sources. There can be a mechanical type of joint inflammation. There can be a chemical type of joint inflammation. So it really depends on what the source is in terms of what kind of arthritis there is.
So, what's going to cause arthritis? We're going to get to how you can prevent it, but what is really the cause? Because here we talk all about underlying causes. So, what can you tell us?
Let's talk first about the most common one is this model, one of degeneration. And we've talked a lot about degeneration over the years and what causes it. It's usually from old injuries where there's been a lot of scar tissue that's been formed. Instead of a regular joint, like this is part of the spine, a regular joint will have a nice big disc and smooth lines to the bones and plenty of space for the nerves to come out and for the spinal cord to go down through. But when these get traumatized, let's say you do a back sprain strain and the joint goes wham like that, it can tear those tissues, and for 3 days they'll be inflamed, but for 12 weeks after that the repair stage happens where your body lays down scar tissue in random dense patterns, which makes it so the joint doesn't move very much anymore. And based on during that 12 weeks, if the integrity of the connective tissue around it has been compromised or injured, it can heal in all kinds of distorted patterns. Some people will heal like this because they got injured more on one side and it pulls it over there. But that new pressure from abnormal position causes calcium and phosphorus to run into that scar tissue, and then it ends up with degenerative arthritis like this, where the excess minerals from the excess pressure infiltrates into the scar tissue, and also if joints aren't moving very well, they're starting to degenerate. So that's the mechanical osteoarthritis component.
Okay, and then we have one that's more of a biochemical side of things.
Right.
And let's talk about that one, and then we're going to get to what you can do to fix it.
Yeah, and that would be usually like a rheumatoid arthritis. Rheumatoid arthritis is where there's a chemical response where the body has started to attack its own cells, like Mrs. Pac-Man. Here would be a cartilage cell or connective tissue cell, and Mrs. Pac-Man's over here, and she comes up and sees this and realizes, hey, you're an enemy to my body. I'm going to attack you, even though it's just a good cell, but for some reason it is targeted that this is an enemy. So autoimmune means that your body is having an immune response trying to attack your own cell, auto meaning your own. So it comes up, starts eating that away, causes an inflammatory response, and that is autoimmunity. And there's many, many different tissues that have autoimmunity. I have 3 different tissues that I found in a blood test that I have actually developed an autoimmunity to. My body started to attack my cartilage, so I had to get a hip replacement. It also started to attack my myelin sheath and my alpha beta tubulin, which are protective proteins in the nervous system. The myelin sheath, if it gets destroyed, that will lead to MS in most cases. So when I looked at the results of these blood tests, all of a sudden I had everything I needed to be able to determine, where do I want my future to go, what I want it to look like. Do I want to be the guy in a wheelchair that has MS, doesn't remember who anybody is, and who's got joint replacements and achy joints all over the place? Nope.
Nope, you don't want to be
So that was the last time, I ate gluten or had a regular beer in 6.5 years. I did have one beer one time after I came out of the mountains on a backpacking trip in the last 6.5 years.
I think I remember that.
Yeah. But yeah.
So if you're out there and you're watching live, you can ask any questions you want, and we'll try our best to answer them. But let's get to the prevention of arthritis and also the treatment. So we have these two types. We have osteoarthritis, we have the autoimmune arthritis. What can we do to prevent and treat each of those?
Well, with the structural degenerative osteoarthritis, basically things need to start getting moving. We got to start to put movement back into here to keep this from continuing to fuse and degenerate, and also start to work on fixing the posture. Get it moving and start to get it back so there's not extra pressure on the bones causing them to pull the extra mineralization in. So it's get it moving. Where there's movement, there's life. You got to try to get these things before they completely fuse. Secondly, with the rheumatoid arthritis, you have to figure out is there an autoimmunity. We suggest looking at cyrexlabs.com, cyrexlabs.com, and look at the test number 5. It's called an array, A-R-R-A-Y. Array number 5 can give you an idea of what tissues may be under attack. And then if we do find something under attack, then we usually test someone for leaky gut syndrome, and also to find out if they are for sure gluten sensitive and other foods that can cause inflammatory and autoimmunity problems to worsen. So we do another food panel as well, and that way we can start to manage it and keep things from continuing to progress.
That's good. Okay, so our steps for prevention and treatment. If it's autoimmune based, you want to do a testing, see what you're allergic to, and see how you can change your diet up so that you're not causing further autoimmunity to happen. And then for more of an osteoarthritis structural, it's really important to look at your posture and look at the scar tissue and what's causing those postural distortions.
Yeah, and the x-rays of the area are the best thing to show that. And we have a low dose x-ray machine that is really super low, so it's not a major health concern at all.
So we always do a lunch with the doc special to give you a action step towards what we taught you about in our show. So today our special is to come in and do an exam, and basically you get to take a look at your whether it's x-rays or we're taking a look at more of the autoimmune side of things. We'll do an exam to determine what might be causing any painful joints, inflammation, arthritis that you might be experiencing. So we're going to do a $97 special for that. So if you call in within the next 24 hours at 949-497-2553 and just say, hey, I watched Lunch with the Doc, I want to do the exam to take a look at some achy joints that I have going on, we would love to have you in. So that's a $97 special, and it's going to last for the next 24 hours.
All
right, so join us next Wednesday. Every Wednesday we do Lunch with the Doc. We're giving you good information on living a healthy life and preventing degeneration and symptoms, and just giving you the best life possible, flourishing life.
All right.
So you're amazing. See you next week.
See you.